The UPMC Family Health Center in New Kensington, Pennsylvania, has provided care to families for the past 17 years. The clinic operates in 1/3 of the Municipal City Hall, an old school building, and so the clinical staff has adapted to less than ideal and restrictive space. Currently, there is the opportunity to build a new center that better supports the patient population and serves as a beacon of health and well-being, reflecting UPMC and St. Margaret Foundation's commitment to communities.
It's an economically depressed community. So how do we invigorate a community? We have to start with the basic need of health. And that's what New Kensington Family Health Center provides. UPMC and St. Margaret Foundation have been invested in this community for decades.
New Kensington is driven by a number of leading population health drivers. In respect to health and well-being, primary barriers include transportation access, technology fluency and access, food insecurity, and comprehension. The clinical staff understand how exposure to adverse childhood experiences, such as the divorce of a parent, an alcoholic parent, physical abuse or sexual abuse in the home, positively correlates to health risk behavior and disease in adulthood. As they treat the family unit in the care they deliver, they aim to mitigate these ACEs. With deep knowledge of primary health drivers in the area, the care team has adopted their model of care to offer services beyond primary, acute, and chronic care.
The central goal of the health center from when it was established, when Dr. Hahn started the health center with Mary Popovich, was to meet the needs of the community. And those needs are varied. And so the health center has evolved as it's been here and continuing to integrate itself into the community. So it started with just addressing medical health and concerns, and we realized that given the issues with poverty and mental health issues, that we need to add behavioral health and social work in as a step, and that was certainly a huge asset for our patients to be able to bring that in to help them with that regard. And then adding medication-assisted treatment of substance use disorders has been another step in a huge healthcare issue that affects our population.
The healthcare system relies on the family health centers to do a number of things. The most important thing, of course, is training resident family physicians so that they can go out and practice and do well for their patients. So, of course, that means some of those residents are going to stay here in the UPMC system and provide care for our local clientele.
I think the work we do is profoundly important because I think some of the things we've done has become a model for other practices like behavioral health and MAT and medication management. So a lot of these interventions and programs are helping to change the way healthcare is delivered. I think we've continued to grow over the years for many reasons. One is that we're in a medically underserved area. So this is actually a federally designated medically underserved area. So there aren't that many primary care doctors. There's a lot of patients, a lot of people here that don't get medical care, or they only get episodic emergency room type care. Now, there's a lot of patients leaving Pittsburgh because I think Pittsburgh is becoming unaffordable in many ways. It's getting more gentrified, so people are coming out to New Ken to live, and so we're seeing a lot of patients that used to live in Pittsburgh proper that are out here now.
As the New Kensington Family Health Center grows and the number of patients treated, volume of visits, and services offered, the strain on the current space and the need for a new building becomes more evident. Many voices have created the design of the new facility, which has informed architectural renderings. Key new features include consultation-specific rooms to support the integrated behavioral health and MAT programs, a designated safe space for children to play while waiting to be seen, and fruit trees in a courtyard that encourage understanding of healthy eating habits.
I think a new facility in that area that's bright, full of light, nice colors would be really uplifting for the patients they serve. And I think there's an opportunity to serve the patients in a wider capacity with, whether that be through nutrition, mental health, all those wraparound services that really is needed in that community.
A new family health center in New Kensington is on the horizon.